Hello, and welcome to Hospice Insights, the Law and Beyond, where we connect you to what matters in the ever-changing world of hospice and palliative care. The results are in. More wins for hospices in HIS appeals. Jake, Bryan, I never thought we'd record this episode, but yet again, we got all these victories for these HIS appeals, which was super exciting. So, Jake, let's start with you, because we did a podcast, you and me, without Bryan, July 20th of this year, letting people know, hey, you might have gotten one of these letters saying you're non-compliant with the quality reporting requirement and that folks should contact us to appeal these. And we actually did get a lot of phone calls from that, but tell us what happened after that.
Sure. It feels like it was just yesterday that we were recording the podcast that you mentioned, advising clients of the issuance of the non-compliance notices. And now here we are just a couple of months later. Nearly every decision has been rendered for each of our hospice provider clients, and all of them have been favorable. All of them have resulted in reversals of the 2% reduction in APU for fiscal year 2023. And we couldn't be more excited for our clients that this burden has been relieved for them and that they'll head into the fiscal year, which starts in just a couple days, with a clean slate.
It felt really good too, and I appreciate the government recognizing that COVID wasn't just a 2020 problem. And because when you think of 2021 and when we got into the nuts and bolts with all of our clients and pulling together these appeals, you almost forgot all of the hardship that went on during 2021 related to COVID. And, I remember one of our clients, they were doing free vaccination clinics, and they're going into people's homes giving vaccines, and just really significant burdens and whatnot. It was really significant. But obviously, as we talked about in our prior podcast, unlike 2020, there wasn't this waiver that was in place where we were arguing last year about, well, it was for the first half of the year when a lot of stuff with COVID was the second half of the year, change how you're maybe applying that. This was a little bit different. And I guess, how was it different, Jake?
That's right. So just to review, for calendar year 2020, CMS issued an across-the-board exemption from reporting requirements for quarter one and quarter two of 2020, probably engaging in the same wishful thinking that many of us did, that COVID-19 was going to be a sort of a transitory event. We were going to get back to normal fairly quickly. That's not obviously what happened. And so when they looked at the quarter three and quarter four of 2020 reporting period, there were still a lot of providers that were facing challenges related to the public health emergency. CMS was very lenient with respect to our reconsideration requests for fiscal year 2022, which corresponded to reporting during calendar year 2020. But it was an open question whether they would take a similar approach to calendar year 2021 reporting, which affects the APU for fiscal year 2023. And so we really had to marshal together some compelling arguments regarding the ways in which challenges related to the public health emergency continued to affect providers in 2021. And one of the things we encouraged CMS to do was to remember, despite the fact that things have moved quickly throughout the pandemic, what circumstances were like at the beginning of 2021. Vaccines were not publicly available at the beginning of 2021. Many personnel were still working remotely, which creates challenges. Staffing issues, certainly absences due to COVID-19 infections, surges in COVID-19 hospitalizations and deaths, and the effect that has on census and all these other things. And then we also had to come up with ways that 2021 was a little bit different, right? Because we didn't just want to repeat the same arguments we made in 2020, but we wanted to come up with something new or additional that we could bring to CMS's attention. And that's where we, in talking with some of our clients about the challenges that they actually faced, we realized that the Great Resignation was huge, for all healthcare providers really, but for hospices specifically, losing large numbers of staff members without adequate notice and trying to cover for their responsibilities. Vaccination, as you mentioned, Meg, that many of our clients were, not just vaccinating their own staff or their own patients, but also community sources of vaccines. So, we really did try and reiterate some of the points that worked in 2020 while also developing some strong additional arguments for 2021, and it's really gratifying to have been successful with those.
And I think the overall theme we were trying to, or I guess question that we were anticipating or trying to preempt, would be CMS getting a lot of these reconsideration requests and thinking, well, shouldn't you have figured this out by now? Or I thought COVID, we hit the peak of that and it's been dwindling, because again, they're going to be looking at these reconsideration requests in July and August and September 2022, which, as Jake said, we had to remind them of what things were like during the actual reporting period. And that's where stuff like the Great Resignation, which I think has become a defined term with a certain time period it applies to in 2021, is how we could put time markers out there for stuff specific to 2021 that would really was our factual basis for saying to CMS, COVID is not over, and the obstacles it presented certainly did not conclude with the end of calendar year 2020. And then, in addition to doing these appeals, we do outreach to CMS informally. We've worked with those folks at CMS in this matter in prior years, and I think it's good to have those connections so we can kind of give them a heads up about what we're arguing and thinking about and do additional advocacy in that way.
And what we're seeing, because I think CMS was definitely open to what the provider experience was, and I think this is a great recognition of yeah, we're hearing you and the difficulties you're having, because I think on top of the Great Resignation and all of the vaccine issues and whatnot, I mean, we also have this weird flow of patients to people's census, right? So a lot of people are getting a lot of admissions, and then their length of stay is just tanked. So you have a lot of work to do in terms of reporting, and I mean, there's a lot of things, sort of a perfect storm for folks related to this. So this is just really, really wonderful, and great work to you, Jake, who was doing a lot of the heavy lifting on these. And so, I mean, I think the lesson learned is, when things happen to you, it's worth a phone call, because I think it happened last year, it happened this year, that people are like, I'm sure there's nothing you can do, right? And then it's like, well, no, and you start asking questions, right? That's what good lawyers do, is they ask lots of questions. And so sometimes they think we're as an industry sometimes too willing to be like, well, I guess I didn't meet it, so there's nothing that can be done. And that's why we have jobs, is to deal with problems and help find a way sort of through things.
Yeah, I think that's an excellent point. Number one, I think first and foremost, we put together strong advocacy pieces on behalf of each of our clients with respect to this issue, seeking reversals, and that's always what it's going to be about primarily. But I think the other value that we were able to add to this is there is some strength in numbers. In other words, when they see 12, 13, 14 of these coming in, all with the same law firm's letterhead, that that triggers their attention, right? Their antennae are up, and they start to think, okay, maybe there actually is a problem here that warrants some additional relief. And so being part of that larger pool of providers who are similarly situated, conveying similar circumstances and making similar requests, I think can be really, really advantageous for a provider that receives one of these payment reduction letters. And then as Bryan touched on earlier, just having a line of communication open with the people at CMS who consider and review these requests is similarly very, very valuable. Unfortunately, the letters that reverse the noncompliance determinations are very short, and they're form letters, and they don't tell us, this is the specific argument you made, or this is the specific reason why we're reversing. And I have to believe that most providers probably don't care, right? I mean, they just want they just want the payment reduction reversed, and they want their full APU for fiscal year 2023. And we're happy to deliver that. But if we had to hazard a guess, I think it's a combination of all these different things that led to success in this area.
Well, and this is exactly why we do podcasts, right? I mean, back when we started this, I don't know if it's 4 years ago or when we started this, but it was to get out timely information to people. And so I think that every time we've done this, people are like, oh, wow, there is something that can be done about this. I heard your podcast. And so that feels good in the sense that, we're meeting our purpose and mission with our podcast and getting out timely information. And I feel like rarely do we have such wonderful news to share. So we needed to get another kick at the can here of just sharing the good news. But I do think that people really need to be mindful of quality reporting. I mean, if we look really big picture, right, quality reporting, we care about it because it can impact our rate, and next year it's going to, if you don't do it, or you don't comply with the 90% threshold, your rate reduction is going to be 4%. So it's going to be even more painful. But right, data reporting and all of this stuff, it's in the bigger scheme of things is becoming more significant as we work with payers and other people, our star ratings, our all these other things. And so quality reporting and having people committed to gathering data for your organization is just really, really important, not just for this rate decrease, but just in the role of the future to be able to talk about how we add value, how we save money, how we do all this other stuff is going to become more and more important. And so when we think about, what hospices have to invest in for the future to pivot to be successful, a lot of it's about data and data analytics. And so right now we're really focused on what CMS is specifically asking us to report, but increasingly as we talk to Medicare Advantage plans and other commercial payers, we want to be able to track even more data than what the government's currently asking us to report on. So data analytics and resources, that is going to become more of a cost center because it's going to be a bigger part of our business to be able to show how we add value. But so I do think, and, all of us, I think, are hopefully feeling a little less burdened by COVID than we were in years past. And so I don't know next year if there will be, the same understanding or not. And so talking about, tracking your compliance and knowing whether or not you're going to run into a problem. And so, Bryan, you were going to say something.
Yeah, well, I think that's the right thing to think about as time goes on. We all hope and think, and I think it's true that people are getting better at dealing with COVID. And I think CMS may have an expectation that people are going to get better at dealing with COVID as it relates to reporting in particular. But that doesn't mean, and to add to that, I think the success for the past couple of years that we've had with this frankly, is due to COVID. I mean, that has been the focus of our appeals, and describing just all the obstacles COVID has put out there. So it doesn't mean that, we can't continue to appeal these going forward. It just means if COVID continues to be an issue that is causing problems with quality reporting, even this year, document it. And there may be things that are happening this year that are different from 2020 and 2021 for particular locations. It doesn't necessarily have to be a nationwide thing to try to address it, but start thinking about start tracking your reporting to see if you're at the 90% threshold. And if you're not going to be at that 90% threshold, really examine why that's the case. And I don't know that a lot of providers are aware of it, but there are also things you can do in real time to try to avoid getting a non-compliant letter next July. There are exemptions from reporting requirements and extensions of time to reporting requirements that are available to providers in certain circumstances. When we've been dealing with this the last couple of years, I don't think providers knew about those, that they could have potentially taken steps back in the year at issue to try to avoid this. So, if you think that you're having a problem with timely submission or being able to submit, give us a call and let's talk through exemptions and extensions of time to solve the problem now rather than having to solve it next July when you might get a letter.
Yeah, no, I think that's a really good point, Bryan. And I do think that in general, there are other, as people migrate to different EMRs, as people have staff leave, as people all the things you can think about that can, impact, because how your quality reporting, who does it, how it's reported, what it's tied to, is making sure from an operations standpoint, you keep this top of mind in terms of making sure, because sometimes it is sort of a gotcha, oh, I didn't know there was some glitch, or that, because you only have 2 passwords for your organization and all these other limitations. So there's a lot less flexibility here. So, if you do have staff changes, or, you're using a different vendor to help you, or, whatever that may be, making sure that you're on top of it, and knowing if you're going to have a problem, because some people, you can see that you're going to have a problem because you really blew it for a certain chunk of time. And so I think it's worth a phone call talking through what's the best strategy. But, once again, awesome work, Jake and Bryan. This is amazing, amazing results. And
Thank you.
I'm like, this is one of the most gratifying things, because it just, oftentimes, you got to push, and to not have to, push further up the chain and things like that, because I think this is the right result. And I really appreciate CMS really listening to, what was happening out in the field.
I'm working on nicknames for Jake. Mr. September, perhaps that's when these favorable decisions come out, or the summertime superstar, because
summertime superstar.
Maybe we should take votes. If people can email in their votes for Jake's new hero name, and maybe even an outfit or something.
Well, I was just going to say outfit. I like the costume part of that.
Summertime kind of covers it all, doesn't it? Because the letters are issued in July, and then the reconsideration requests are due in August, and then we get the decisions in September. So it really is this time of year, late summer, where this process begins and ends.
So Jake's vote is for summertime superstar, I guess.
Yeah, I guess so. So we need to buy you a cape and a little, you could be Robin, Bryan.
I'll be the
Robin.
faithful sidekick. Yeah. Yes, happy to do that.
Hopefully we're not dealing with too many of these in future years, as providers are able to adjust to their staffing levels and COVID-related challenges. But as Meg and Bryan represented, we're here for you if you do run into an issue with potential non-compliance with the timeliness reporting requirement.
At the minimum, it's always worth a phone call because, and this is not tooting my own horn, but rarely is there something that someone calls us with that we have not dealt with. So, and there might be nothing that can be done about this or, whatever thing you may call about, but most things we have some level of experience with, and so can help, quickly navigate things, and is this worth an investment or not? So, and I think this is just one of those examples because we do have clients in, nearly every state. And so, we see these kinds of trends and can really bundle them for people.
Yeah, and that calculation with reference to is it worth it, I think it's going to skew significantly towards yes, it's worth it when that penalty goes from 2% to 4%. I mean, that's a big difference, right? It's double. And so for the 2022 reporting period, fiscal year 2024 APU, that's the first year when it will be a 4% reduction as opposed to a 2% reduction. And so that's something where, you'll really want to put your best foot forward as far as reconsideration goes.
Well, yay to winning millions of dollars for people, Jake and Bryan.
Yes.
So it's a wonderful thing. So thank you again for your hard work. And this is such a wonderful recording that we can actually do this and celebrate it. So thank you.
Thanks, Meg.
Thank you, Meg.
Well, that's it for today's episode of Hospice Insights, The Law and Beyond. Thank you for joining the conversation. To subscribe to our podcast, visit our website at hushblackwell.com or sign up wherever you get your podcasts. Until next time, may the wind be at your back.